So today we're going to talk about a very strange condition, which is Ppd. It stands for persistent, which means it has to be chronic. It's generally greater than 3 months in duration or more. And it is a postural problem. And what that means is they feel like they're going to fall down. So they have postural sway, and that might be interpreted to the patient as vertigo or dizziness, and that means they're going to end up with the vestibular workup, both peripheral and central. The vertigo in Ppd is usually non-rotational, which means they just feel like they're moving, but they don't actually have the subjective illusory sensation of rotation. And it's a perception disorder because there's no structural lesion, and as opposed to peripheral and central vestibulopathies where there's actually a sign, there's no sign here. So there's no peripheral finding, there's no nystagmus, there's no Dix-Hallpike maneuver positivity, there's no other neurologic focal sign. And it causes dizziness, and that normally does not come to me. Normally that goes to ENT, but the reason you need to know it is one of the precipitants of persistent postural perception dizziness is the visual stimuli. So they have some sort of mismatch between the vision stimuli and the vestibular stimuli. And when you have that mismatch, you'll get the perception of dizziness. And you can watch the visual variant vertigo video if you want to see what that looks like in terms of just the vision symptoms. But this is one step further than just having the vertigo. Their posture isn't right, so they feel like they're going to fall down all the time. And so the patients have very specific complaints. The effect is triggered by visual stimuli. So usually it's motion in their environment. It can be, I'm watching a television show and someone's dancing, that can precipitate it, or even walking in the supermarket because they are going down the aisles and the canned food is kind of just inducing a full field optokinetic nystagmus response, or driving. So the differentiating features are it can't have any peripheral vestibulopathy finding, and that means it's not positional. So it's not a position of their head problem like benign positional paroxysmal vertigo. It's postural is the symptom, not the symptom caused by the posture. And the other interesting thing is they're going to have a negative workup. So ENT is going to do their usual things, Dix-Hallpike maneuver, rotary chair, calorics, ENG, all that's going to be negative. Neurology is going to see the patient, and there's not going to be any focal finding. And they're going to do an MRI scan and an EEG and a lumbar puncture and a whole bunch of labs, all going to be negative. So this is going to come to the eye doctor, and the eye doctor's not going to find any nystagmus. So as opposed to peripheral and central vestibulopathy related nystagmus, which is also its own talk and its own video, this is going to have a normal exam. The whole thing is just talking to the person. They have dizziness that affects their posture, precipitated by looking at visual motion. This is the key criteria for diagnosing a persistent postural perception dizziness. There's not going to be any sign, it's just you talking to the patient, but it's a very classic description. Motion in my environment triggers my perception of posture to be altered. I have subjective non-rotational vertigo, I feel dizzy, and I've seen ENT, neurology, had an MRI, EEG, lumbar puncture, and a million labs, and nothing was found. This is the diagnosis of persistent postural perception disorder relating to dizziness.